Okay. And apologies to everybody who was waiting. We had a little mix up with the link, but now we're here and ready to present. So we hope you're having a great start to the year. I have the pleasure to kick off this year with a very interesting, exciting discussion on building living evidence communities. And it's about lessons from the HPV partnership. Personally, what I think is most exciting about this session is that it is focused on a real case application, which is something that perhaps some of you, if you've been participating last year, or new participants throughout last year mentioned that they like to see more of. So we really hope you enjoyed the discussion. So as usual, we have a few notes on how you can how you can help us make the session a success. So first of all, for the conversation to run smoothly, please keep your microphones off until invited to unmute. The session is recorded and will be shared online. And for you to know, you have been added to our mailing list by subscribing to this event. But you can unsubscribe at any time if you would like to do so. You just need to request it. And if you have any queries about these or any of the forum sessions, please contact us as coordinator at alive.com. .org, aliveevidence.org. We are using Wordly for live translation. If you would like to make use of it, you can click on the Wordly link that is at the top right corner of your screen, and you can choose your preferred language from the list. Once you do that, you'll have a window pop up so you can move the Wordly window to read the translation while still seeing the meeting. So today we would like, before starting the presentations, we would like to know where you are joining from. And as more participants continue to come in, we'd love to know if you are able to use this Mentimeter. There are a few ways you can join to use the Mentimeter. So if you're using your phone, you can just scan the QR code on the screen and it'll take you straight to the question. Or if you prefer to use your computer, you can either click the link in the chat that I'm going to send in a moment, or go directly to menti.com and use the code A3259840. So if some of you are able to join and you can start telling us where you are from or give us a reaction, tell us if it's working, that would be great. Okay, I see the first answer coming in, so it should be working. I'm gonna write the link. Okay, we're seeing a few answers already. I'm also copying the link on the chat if someone is not able to join. So we have a few participants from Africa, one from North America. I see some are based in Europe. One is perhaps, I suppose that's Canada. Is everyone able to participate? Okay, I see more coming in. Yes, that's great. Okay, so as we continue seeing more and more people replying, we can see that we have a somewhat global audience today, so that's very interesting for us, and that makes it especially interesting to hear your reaction on what the presenters have to share today with you. It would be very interesting to know how it relates to your local context or the work that you've been doing. And just for you to know, we'll be using Mentimeter throughout the session, so make sure to keep the tab or your window open on your phone or computer. For you to know, participation is completely anonymous and voluntary, and it doesn't require any previous preparation. So just feel free to jump in, share your thoughts, and co-create the session with us. I think something important to say is that one of our goals at the Learning Forum this year is to build a strong, connected community, and this is one of the ways that we can make the sessions more interactive and shape them together. So moving forward, we have a second question to get to know your expectations for the session. We'd love to know what brings us together at this moment. So I'd like to invite you all to take a few seconds to share with us, the speakers and other participants, in one word, what brought you here today? Users. Okay, interesting. So someone is very interested about knowing, perhaps, I suppose, about evidence users. Collaboration, that's great. That's one of the goals of the forum. Well, living evidence, I suppose that brings us all together here. Evidence synthesis, learning. We have living evidences as well. Some are interested in, I suppose, in the HPV partnership per se. Vaccination, collaboration. It seems like most of us are interested in living evidence and HPV, so that's perfect because that's the topic of today. And we will throughout the session ask a little bit more about your familiarity with living evidence so that we get a better sense of what are the questions around living evidence that you might have. Let me see if there's something unexpected. Collaboration, users, AI, okay. So some are also interested in knowing how AI is related to the work in living evidence. So we have also some interesting insights there. Thank you very much for participating, every one of you, and for sharing your expectations. I think that you've let us know a bit about why you're here. Now it's time for us to let you know about the Learning Forum. For those that don't know already, the Learning Forum is an open access network where evidence leader shares innovation, practical strategies, and real case studies to strengthen living evidence partnerships. It is also a global exchange for advancing living evidence through collective learning. So very aligned with some of the words that you were just sending us. And the idea is to have that through a multilingual live translated sessions, our global community co-creates more timely, effective, and affordable approaches to evidence production and use. And for those who are maybe new to the topic, when we talk about living evidence, we mean evidence that is continuously identified, synthesized, and updated to keep pace with rapidly evolving knowledge and decisions. So that's about the forum. Now we have a little bit about me. I'm your host today. I'm one of the forum co-chairs, but we are a group of 5 co-chairs that you'll be meeting throughout the year. My name is Daniela Garcia Villamil. I hold a master's in international law and human rights, and I would say that most of my work has focused on participatory action research and knowledge mobilization. First, I work within more local development initiatives and lately within more international policy initiatives. And I guess briefly, I can just say that I'm interested in anything that strengthens research practices, and especially to inform policy or practical applications. So this is our agenda for today. The first half of the session will be hearing 3 short presentations on the HPV partnership. First, we'll hear from Fumane about the partnership itself, so who they are, the community behind the work, and how the living systematic reviews support evidence-informed decision-making. Then Thelma will tell us a little bit about the evidence repository and map, so showing us how the evidence is organized, how you can navigate and use it, and how it supports transparency, updates, and knowledge translation. And finally, we'll look at how automation and LLMs are being used to support living evidence workflows, what this enables, where the limitations are, or some of the limitations are, and what this could mean for the future of living systematic reviews. So that's for the first half of the meeting. Then for the second half, we'll have a short panel discussion with the speakers, and we'll finalize with your questions and contributions if you have any. So at this point, we would also like to know what best describes your familiarity with living evidence. So are you more exploring the topic? Are you already experimenting with it? Are you using or applying living evidence already, maybe in your work or in your projects, or you're still unsure what that means? Okay. Seems like applying is taking the lead. I'll give it a few seconds to see if more answers come in. Okay, that's very interesting. So if most of you are already using or applying living evidence in the audience, we would really like to welcome in the discussion some of the concrete examples, questions, or lessons that you've learned using and applying living evidence as we move through the session. So please go ahead, and whenever you have something to say, something that resonates, common challenges, please drop us a comment in the chat, and this will be also very interesting for the panelists themselves to know what are your concrete concerns or the interest that you have in this session today. And lastly, before diving into the presentations, we'd like to understand a little bit better how you engage with living evidence in your work. So could you tell us briefly which role best reflects how you engage with living evidence? Are you a researcher or evidence producer, evidence user, decision maker, intermediary, none of the above? Okay, we have at least 4 researchers in the room. Okay, interesting. 1 knowledge broker or intermediary. Most of us researchers, okay. Evidence producers and researchers. Okay, great to see so many researchers here. So as we go through the session, we'd also love to hear how living evidence connects to your current work or where you see opportunities and challenges. It would be, I think it can be a very fruitful session. None of the above. I wonder what that person is. It would be interesting if whoever replied in the none of the above, if you feel like that, if you feel like doing so, you could drop us a comment in the chat. What's your role and why are you here today? Okay, I'll move forward in the interest of time. So our speakers today, I have the pleasure to introduce you to Fumane Lekoala. She's the head of evidence partnership for HPV and the Future Evidence Foundation. The partnership operates as a multi-country initiative supporting low and middle income countries to strengthen HPV vaccine delivery and adolescent health integration across Africa. And her work is deeply rooted in advancing gender responsive, youth inclusive, and equity-driven evidence ecosystems. We also have with us Thelma Eni Akah. She's a PhD fellow and researcher at eBase Africa. And Thelma has wide-ranging experience in rapid review, stakeholder engagement, and health system research across Francophone and Anglophone Africa, with a strong focus on community engagement and evidence use. We also have today with us Dr. Ailbhe Eni. She's the research fellow at UCL Social Research Institute. She specializes in automation tools for systematic reviews, human-computer interaction, and behavioral intervention frameworks, bridging psychology, technology, and evidence synthesis to improve how evidence is produced and applied. And last but not least, we have with us today Dr. Rita Tendal Jeppesen. She's the chief scientist at the Future Evidence Foundation, bringing extensive global experience in evidence-based decision-making from leading national guideline programs in Denmark to shaping Australia's COVID-19 clinical evidence task force. Her current work focuses on applying the ALIVE framework to living evidence for HPV vaccine delivery and exploring AI-powered living evidence for climate and health. So we're very excited to hear from you all today. And without further ado, over to you, Fumane.
Thank you very much, Daniela. Can you confirm that you can see my screen, please?
Yes, it's working perfect.
Okay. Just a minute. Okay. Thank you again, Daniela, and hello, everyone. My name is Fumane, and as Daniela has already alluded, my work currently focuses on how evidence actually gets built, shared, and used, especially when decisions cannot wait. So today I'll talk to you about what we are learning through the HPV Evidence Partnership. And that means what it takes to build living evidence, and to make it useful and connected to the people making real world decisions, and some of the trade-offs that come with that. So this is the Gates funded program that has been running from 2024 and will go until 2027. Really, the overarching goal of the program is to achieve high, sustainable, and equitable HPV vaccine coverage. And the project responds to a key challenge, which is that evidence on HPV vaccine delivery is growing fast, but decision makers struggle to keep up or to apply it consistently. So as you can see, we have a whole pool of vaccine development, research, and experience. And despite all of that, decision makers still struggle to access usable, timely evidence when they need it. So this is what we think a successful HPV living evidence system looks like. We have a living evidence community and we have a living evidence bank. So in this case, decision makers don't just consume evidence, they shape what evidence gets prioritized. And that is why facilitation is crucial, which is what us as Ailbhe do. So the system helps surface needs, engage with the evidence, and apply it to real decisions. In short, priorities shape the evidence, evidence stays current, and the community helps it land where decisions are being made. So if a successful system depends on those two components working together, the next question is, who is actually part of the community and how is it held together? We have within the community, it's a whole pool of community of practice. Within it, we have the steering group, we have tactical groups, and we have advisory groups. And what matters here is not the circles, but the fact that it keeps decision makers connected to the evidence as it evolves. But community on its own isn't enough. It has to result in evidence that people can actually use. And that's where we come to the HPV Living Evidence Bank, which is composed of living repositories and evidence maps. And these are the maps that show what evidence exists within HPV delivery, where it sits, and where gaps remain. We also have living systematic reviews, which are continuously updated syntheses, and they answer priority policy questions, and the living evidence tools. And these are summaries and decision support outputs that directly support decision makers, which are HPV managers, as they work. So these components they turn fragmented research into evidence that can actually be used as decisions are made. And this becomes important when we are dealing with misinformation, where delays or gaps in evidence have real consequences. While this work is grounded in HPV, the structure is deliberately transferable to other immunization and public health challenges. Currently, we're working on 2 living systematic reviews, mainly on misinformation. So the first one will be focused on detecting misinformation, and the second one will be focused on addressing misinformation. So for us, living systematic reviews are what keeps the evidence alive. They let us revisit priority questions as the world changes instead of freezing conclusions in real time. And that was a short introduction. And I will hand over to my colleagues from UCL and eBase and actually look forward to engaging with the panel later on. Thank you, Daniela.
Thank you, Fumane. Thelma, I think you're next, if you'd like to go ahead. Thelma, I think you're muted. Great, we can see your presentation now.
Hi, everyone.
Yeah.
And welcome to the session. Thank you, Daniela, for giving me the floor. So today I'll briefly introduce the living evidence ecosystem we are developing under Ailbhe for HPV vaccination, and focusing on the evidence map, and the two living systematic reviews on misinformation that are currently under development. And this is a collaboration between Ailbhe, Future Evidence Foundation, eBase Africa, and UCL. Okay, so the reason why we are doing this living evidence for HPV is because the HPV vaccination sits at the intersection of service delivery, community trust, and information ecosystem. So evidence is growing quickly, misinformation is also evolving rapidly, and policy decisions cannot wait for one-off review. So despite the fact that the vaccine is highly effective, the coverage still remains uneven. We still have delivery barriers and misinformation, especially those that are context specific. So static reviews cannot keep the pace with evolving evidence and narratives. And decision makers need timely, usable, and continuously updated evidence. So for the Ailbhe HPV Living Evidence ecosystem, we have the first living evidence and gap map, which is on delivery. We also have a living systematic review on detection and misinformation, and we have one addressing misinformation. So rather than an isolated reviews, Ailbhe supports a connected ecosystem, which is the living evidence and gap map on delivery, supported by the two living systematic reviews on misinformation, one focused on detection and the other on response. So in regards to the first protocol, which is on living evidence and the gap map on HPV vaccine delivery, our goal was to provide a comprehensive HPV vaccine delivery evidence repository and an interactive map to inform policy and lead to strategic decision making. And so this living evidence and gap map on vaccine delivery has completed its initial phase, and we are now in the living phase where new evidence is regularly added and the map is continuously being updated. Our scope was on the delivery strategies, the health system readiness, demand generation and communication, equity, gender and access barriers, and monitoring, governance, and financing. So the HPV delivery evidence repository and living map indicates that there's a clear gap, and despite the growing HPV research, evidence on how vaccines are delivered, especially in our real-world setting, is still fragmented. Hence, the living repository responds to this gap by acting as a single but continuously updated home for delivery-focused evidence. The map is built directly from the repository. So we have records that cover HPV delivery, and from 2007 right up to 2025, and it is updated, or the searches are regularly updated, and it plans to be updated right up to 2027. So if you scan the QR code on the screen, you'll be able to access the map, and also it will give you directives on how you can use the map. So the map translates the repository into something that is usable. So instead of having to read hundreds of papers, the users can immediately see where evidence clusters exist and where there's little or no supporting evidence with regards to both policy decision-making and future research agendas. The map and the living systematic review are not separate products, and the map shows where evidence is thin or emerging, and those areas can be explored in depth through living systematic reviews, such as the one that we want to do with regards to misinformation. So this is not just a database. The map makes the gaps visible by geography, strategy, population, and also the outcomes, supporting the prioritization for research and implementation. So on the map, you can be able to explore evidence on who is being reached, how vaccines are delivered, what outcomes are measured, where evidence is strong and where it is missing. The key things we can take away from the map is it answers the question of what evidence exists and where. The repository answers where we can find the studies, and the living systematic review shows us what works and why. So together they form a living evidence ecosystem or living evidence system. So we now move to our second protocol, which is still under development on detection of HPV vaccine misinformation. And we are looking at synthesizing the global evidence on how HPV vaccine misinformation is being detected. Because before misinformation can be addressed, it has to be identified early across the different platforms from which it can emerge from, such as online platforms, community networks, and traditional media, especially in the LMIC context. So these are anticipated focus areas. It's still anticipated because we're still developing the protocol. So moving on to the second protocol, which is the third, we also want to look at how to address HPV vaccine misinformation, the different strategies that we can use. So we want to look at the responses of what works for whom and under what conditions when misinformation threatens HPV vaccine uptake. And these are also the anticipated scope we are looking at to target or address misinformation. Together, these protocols create a coherent pipeline from understanding the delivery system to detecting misinformation and to addressing it using a shared living evidence approach. So there's that interconnectedness from delivery challenges to misinformation and to addressing the misinformation. With regards to our governance, engagement, and next steps, this work is governed collaboratively and designed for direct use. We have a living evidence community under Ailbhe. We have steering and tactical groups. We have the open data repository, and we have the delivery map, which is live now. And we also have the protocols, which are under progress. So those who can have access and use this map, we have the ministries, we have EPI teams, we have NITACs, we have different partners that can make use of the map. So thank you so much for your kind attention, and I'll give the floor to my other colleague to continue. Thank you.
Thank you very much, Thelma. And I think it would be great if, while we hear to the next presentation, you could link some of the tools that are live now, or if anyone in the audience wants to explore them a bit more after the presentation.
Just to confirm, you can see my screen?
Yes, but we're seeing, if you go to presenter mode.
I'm going to do, I think everybody will disappear, so I won't be able to see anybody when, when this happens.
Yes, now it's working great.
Okay, thank you so much. Thank you, Thelma, for your presentation, and Fumane. Today I'll be speaking about my role in the partnership and how we support the use of automation in evidence synthesis. The information is at a high level of how we support various teams through our software and collaborations, rather than very specific details of this work, but we can answer questions afterwards if required. So our role in the project is to support the team in their work to create a living repository and to conduct the systematic review in a timely manner that is fitting for the real world implications of these maps and reviews. It's wonderful to have the opportunity to be involved in this work that has such potential for real world impact. Working in automation, we don't always get this opportunity, so it's wonderful to be involved in the partnership. To this project, our team brings experience with systematic reviews, evidence synthesis, and automation. I am working at the Epicenter, and we have a software called Epi Reviewer. So the Evidence for Policy and Practice Information Centre is a team of researchers and professionals based at UCL in London. who conduct systematic reviews across health, education, welfare, and other public policy sectors. We work closely with policymakers, practitioners, and the public to understand their needs. We study and develop methods to support the conduct of systematic reviews and their use in decision-making. And then we also provide training and support and guidance for others seeking to undertake systematic reviews through the software, and we develop and maintain the HPV Reviewer software for conducting systematic reviews. So HPV Reviewer is a web-based software that supports the management and analysis of data with integrated automated tools for enhancing and supporting the review process. Part of my work with colleagues in the Epicenter is the development of a pipeline where we assist teams in getting the review set up, provide onboarding and training for HPV Reviewer, and getting started with using automation within their work. In this partnership, we can share our experience in methods of using AI and on evaluations of the use of automated tools and AI in systematic reviews and evidence synthesis. Thelma has already talked about growing evidence and the challenge of keeping on top of the ever-mounting evidence that is produced. So traditional systematic reviews can take up to 2 years from the start to being published and made public. This timeline may be out of date at this stage, but this was previous research that was done and found that it can take about 2 years. The current rate of research publication has made it so these reviews can be out of date before they are published. And the current challenge in evidence synthesis is getting the findings made public for relevant research and policy makers to make use of it. The challenges are having limited resources, usually time and person related. And the process of conducting systematic review takes many hours of work and the various processes and steps involved in it. Those that need the information have even less time and need the evidence quickly for it to have an impact and real-world implications. The Living Evidence Framework allows the frequent updating of the evidence and perhaps breaks the time-consuming tasks into more manageable chunks, given that the updates are done more frequently, maybe smaller chunks are done at regular intervals rather than taking a longer time. However, the rate of evidence production is still as fast, and the resources in terms of time and human work is similar. Automated process can ease the burden of the human reviewers. These can be automated searching and updating of new research, deduplicating records within databases and repositories, and assisting with the screening and data extraction and evidence synthesis. There are a lot of tools that have been produced. So from a search of automated tools for evidence synthesis, this was a couple of years ago, gave us a list of almost 400 tools. Using criteria to narrow down the list to tools for automation and for being specifically for systematic reviewing resulted in 67 tools. This is the list on the right. Further identification was done on how many of these tools that were produced and available were evaluated. There were 214 evaluations, with many being done for the same tool, and most of these were found for tools involved in the screening process, among other processes. There are a lot of tools available, but automation tools are often not used. This can be because the onboarding or training for them is not available. So it can often feel quicker for the researcher to fall back and do their own process, which feels more familiar and feels to them like a faster option instead of taking the time to get involved and use new tools that are unfamiliar to them. Many tools are developed as part of a grant or a project and were not maintained beyond the funding, and they may also be addressing specific problems that may not trans well across other domains. Another similar issue is that the tools are not evaluated before being released, which means that they may not work at all. They may not work for your context, or they may work, but maybe can't be applied across different domains and different research data sets. Not specifically a tool, but a new technology that's available for use and is becoming embedded in many tools are large language models, LLMs. A few of these tools can incorporate LLMs claim to be able to do systematic reviews in a few clicks. This would be amazing, but I'm very skeptical about it. And so it's new technology that's available and it's very popular at the moment. Large language models can do more than the technology available for these tools 5 years ago. Some of the work that I was doing in automation in 2022, 2023 is now obsolete because the LLM can do the task much quicker than the old method. So we're in the process of evaluating our older method to our newer method to see what has changed and how well it performs. So LLMs are developed and built on mountains of information available to them, which gives them a lot of potential power for the use in evidence synthesis. By involving specific data sets and experts, we can further train the LLMs for particular use cases and research questions by giving it examples to learn from. In our use case of using LLMs in systematic reviews, it can help reduce the burden by performing some tasks to assist the humans. So it can reduce the screening burden by helping out with doing screening on title and abstract, a first mapping of broad topic areas, and then semi-automated data extraction and semi-automated synthesis. In our work, we've had a lot of success by semi-automating the screening process by using the guidance that are developed by the teams to create prompts for the LLM, so kind of instructions to the LLM that are aligned with how human reviewers are trained to screen the research papers. Within Epi Reviewer, we've developed a pipeline for assisting teams with automating their reviews. So an example is on the image on the right-hand side. This work is still an evolving process where we're learning with the teams that we assist. So while we're offering support in using the technology and using our platform and our software, it is very collaborative in nature, and it's beneficial to us as we are learning to apply these tools in a reliable, consistent manner. So all of these automation tools are available within the Epi Reviewer software. So semi-automating searching, deduplication, screening, and data extraction. It allows you to select what you want to use automation on and offers an easy way to develop and test and evaluate the automation in systematic reviews. The pipeline can start with finding new studies through integration with OpenAlex, which is an open research database, all the way down to the synthesis stage. We use the term semi-automation more often than we use automation in our work and in our pipeline. And this is because there's not one part of it or one tool where I wouldn't incorporate human knowledge and expertise. So that's something that is very important to our work, to make sure we incorporate the human knowledge into the evidence synthesis. The starting point of every pipeline is human supply data through annotations or screening decisions. So whenever we are using tools, building tools, or evaluating them, we're using human decisions and human data that's been supplied. You can make the reports to compare the AI results with the human data. And so in the work that we're doing, we're supporting teams across education, health, government, social sciences. It's not a one-size-fits-all pipeline. And so we work with the teams to be able to support their goals and research questions, and we tailor the pipeline to fit their needs. So it's very much kind of a collaborative and interactive relationship that we have with the different teams. So LLMs have great potential in this field. However, responsible use of AI is key to ensure the continued high quality of the results while using automation. We're seeing many tools using LLMs being produced with very little evaluation or clarity in how well they perform. Some studies are being published with some data, but not enough to replicate their findings. In our work, that we are very much focused on evaluation at the moment, so that we support the use of automation, but in a very responsible way where you can verify the performance of the AI and making sure that it compares to human-related work. In cases where the evidence has an impact on health and well-being, it's even more important to do evaluation of the tools. In this project, we're evaluating how well the AI performs by comparing it to the human data, which was done first in the process, setting a benchmark. So when we're doing evaluations, we're comparing to human annotations that have usually been supplied to us at the very beginning of the project, or when you start doing a search, the screening is first done by humans, and we use that to be able to develop prompts and run the LLMs on the remaining data. So we're testing to see whether the LLM and the humans agree. So we're calculating the agreement to make sure there's high agreement before we would use the LLM unassisted. We get humans to do checking of the results that come in from the AI. And then we also ask to do blind human comparisons, so where we ask, without checking the results of the AI, that if 10% or less than 10% of the results will be checked by a human. This is because it's been found that the human can be biased and often agree more with the AI than it does with their own results. And so that just to prevent the biasing. So that the performance that we're looking at is looking at the agreement between the human and the AI, and looking at error analysis, looking at where there was disagreement between the AI and the human, and using them to shape how we're going to be moving forward with the next iteration of prompts or using automation. Thank you.
Thank you very much, Ailbhe. And I think, Fumane, you'd like to finalize the presentation?
Yes, I'd like to conclude with a call to action. You have heard all about the HPV Living Evidence Community. So this is an invitation. If you are a decision maker, an advisor working on HPV vaccine delivery, whether you are an evidence producer or intermediary interested in living approaches, If you are a technical and delivery partner supporting evidence use and adaptation, if this is you or you know someone who'd be interested in the three components that I've already talked about, we are offering a space to shape priority questions, access to living decision-relevant evidence, and a community focused on use, not just production. So I think this call to action is that if you want evidence that stays relevant as decisions evolve, would love to hear from you. If you visit, I've shared links on the chat for the repository and the map, as well as the HPV Living Evidence Community website. You'll find an email where you can reach us on. I'm also available on LinkedIn. You can search Alive on LinkedIn and just send an inbox. We'll be happy to hear from you. That's it from me. Thank you, Daniela.
Thank you very much to all the presenters, and thank you, Fumane, for that call to action. It would be really interesting if the audience reaches out. If there's something that caught your attention, please don't hesitate to reach out to the speakers or to the Alive community. We have now a few minutes for the panel discussion, so I think I'm going to ask the speakers to try to be as brief as possible. The first question we have for whoever wants to reply is, what has been most valuable about working as a partnership? So what different do you think has it made in the practice, for example, in how evidence gets prioritized or produced, on what trade-offs, if any, sorry, have emerged?
Maybe I'll go first because I'm already unmuted. I think the fact that in practice, evidence is more aligned and real policy and program decisions rather than academic timelines. And the trade-offs are that it takes longer upfront to aligning priorities, negotiating scope, and coordinating partners. But I think what we have found is that the investment pays off later because the evidence is more likely to be used and updated rather than for it to be sitting on a shelf. This is, as we have mentioned, this is a pilot, and we're really looking forward to learning more insights as we continue with the work.
Thank you very much, Fumane. And I think that element of the investment phase of later is something very important to also keep in mind for funding processes, because sometimes we are expecting really fast outputs. And as you just said, the investment phase of later. I would like to ask now a little bit more about the repository and some of the invisible work that goes into building and maintaining both the repository and the evidence map. Maybe the evidence users or the audience here today don't see or is not so often discussed, but something that is maybe key for updating accessibility, usability, or transparency in the tools.
Okay, I'll go in to answer this one. Actually, building and maintaining the repository requires extensive invisible work. We have aspects about running the searches, rerunning the searches, managing the duplication across multiple sources. We also have the concept of screening, doing data extraction, and documentation. Behind the scenes too, we had open discussions, back and forth meetings to talk about the different challenges that were arising during the process and also how to amend them to make the work more easy. We also had looking at training the reviewers on the exclusion criteria, looking at the codes, the framework, and also looking at aspects around conflicts of interest. We also had to align the EP reviewer center sets and governance processes. So what appears to the users as a simple interactive map is in fact sustained by continuous methodological, technical, and governance work that collectively forms the backbone for reliability, transparency, and making the repository user-friendly. Thank you.
Thank you so much, Thelma. That was actually a lot of the invisible work, and I think that speaks a lot to well, on the one hand, the need for these processes, but also it connects very well with the next question about automation, right? Because I think some of those elements are being breached with automation or trying to be surpassed or optimized with automation. So I think the third question, it's precisely about that. And automations and LLMs are often seen as a solution for scale, for sustainability, for responsiveness, perhaps to try to eliminate a little bit of that burden of the invisible work. So I would like to know, in your work, where have they genuinely helped? And where do they actually feel like it creates new or more work or risks? Is there anything that you maybe think that people tend to either overestimate or, on the contrary, underestimate about automation in evidence work?
Yeah, I can answer to this one. So I suppose kind of that, yes, LLMs are useful for working at scale and responsiveness. So in projects that I've been involved in, so this one as well, but another project where there was a huge amount of research to be dealt with and there was a very short time frame. So I think that they had a few weeks to be able to do the entire research project, and they had started with 100,000 studies and had to screen these. And so we've seen that by using a combination of human-led screening and guidance and using prompts for specific criteria that they needed the region of conflict, I think is what it was. And so that being able to write a prompt where you can get that information very quickly has led to bringing their 100,000 down to a very manageable way of working. And then in their next step for the full text screening, where we wouldn't advocate for the use of AI kind of at that step, but they needed it. And so that they did a short form data extraction at the same time as screening. Creating more work, I think just at the beginning, making sure that they're evaluated properly. I suppose that's more time consuming than you would just let them run and just accept that the results are correct and fine, and you can just move ahead without doing any human checking. So I suppose there is still a human burden of evaluating the work. I think overestimating and underestimating, that I think that you can overestimate how well it can perform. So I think that kind of even small changes to a prompt, the wording of a prompt, can change the results drastically. And so I found that in my own research by just reframing kind of how the question you're asking can change the results, especially when you can compare them to the ground truth data. And I think underestimating, I think maybe there's not as much people who are skeptical about using LLMs. I think that they might be underestimating how much it can actually assist you if you do it in the right way by having semi-automated processes or having the human in the loop as part of your work.
Thank you very much, Ailbhe. And I think that's something that will stay with me, is the element of calling it semi-automated processes, because that's what actually talks or it actually tells about the involvement or the use of automation and LLMs. So thank you very much. We have one question from Thelma. He's asking, does the current evidence around HPV support expanding the HPV vaccination programs to include other age ranges? Perhaps, I suppose, Fumane, would you like to answer to that?
Yeah, I'll take that. I just put in a comment in on the chat to say that the most valuable aspect has been working with decision makers generally involved from the beginning rather than them coming at the end. So as we have already been saying, they help shape the priorities because they're involved with them at the very, as they work and they know what their countries need. So they are the ones who have come up with a priority for misinformation, and they continue to shape where the other LSR living systematic reviews will lead. The question of expanding the HPV vaccination program has come up, and we are looking at it. But the countries who are involved in the steering group are the ones who will come up with the final prioritization list. Which is why I'm saying, if you feel this is needed, maybe you need to join us. Thank you.
Thank you, Fumane. And Tamu, you got their invitation to go ahead and, connect with Fumane and with the partnership and share a little bit more about your concerns or intentions. And finally, we have 1 minute more for our last question. Any of you can answer. So how do you think the future of decision-making will be thinking that we'll be having repositories, but also chatbots? Will there be a room for knowledge brokering?
I can just say a few words to this. Kind of like, I'm not in the evidence synthesis space. I'm not an expert, but I think it's came up in a conversation earlier in a different meeting about knowledge brokers. And I think that what was discussed there was that in terms of the automation, we're developing tools and AI for, the research production, so the evidence synthesis part. But they were saying that there's AI needed at that step, kind of with the knowledge brokers, to be able to get the body of evidence quicker to the policymakers. So I think that there is the space for knowledge brokers, but there is space there for supporting them through more automation. So I'm not sure if that answers the question, but it's just it sounded relevant to something we were discussing earlier.
Thank you. Thank you very much for your insight, for your expertise, for sharing this time with us today. Before we close the session, we're nearing now the end. We will use these 3 minutes just to quickly ask the audience, what's your main takeaway from today's session? So if you would go to Mentimeter again, and if you would like to share with us what's your main takeaway, maybe you can also tell us about questions that were left unanswered, something that stuck to you, something that you keep thinking about after the presentations. I don't know if the people are still connected to the Mentimeter. I see 26 people, but maybe this is a trick question. Okay, we have some answers coming already. Okay. User engagement. So there's a lot of interest, I think, also on tech-enabled research, right? I think this is one of the elements that has been coming up a lot throughout last year, and we can see it also very present today. In one of the figures by last presenter, I was wondering if human AI teams also do screening together. Maybe.
Yeah, so would that mean that, so I think that, yes, you can have the AI as a second screener, I suppose, in situations where there's double screening. And so that we check the work of the AI, but also that we do comparisons with the human AI. So I think that once you have high agreement, you can use the LLMs sometimes to do the screening, and then it would be like the human would be doing a checking. So I think that is kind of a human AI partnership, I think, if that answers the question.
Thank you, Ailbhe, very much. I'll just move on to the next slide. If someone has any thoughts of anything you'd like to see in future sessions of the forum, that would be great. You can either write it in the Mentimeter or in the chat, or also if you think about it later this week, that's something that you would like to see in the session. Even if you, for example, if you think you want to present some of your work, just drop us an email or write in the chat, and we'll make sure to organize that. I'll just move forward because we're now right on time. So the next session will be on 10 February 2026. It will be a very special session because we'll be celebrating the anniversary of the Learning Forum, and we'll be sharing insights from a year of coordinated efforts. So mark your calendars, make sure to register, and keep engaged with us. And for those who have stayed till the last minute, thank you so much for being here. Thank you for your contributions, your insights, your thoughts, and thank you for taking the time off to share with us. If anyone of you who are still in the audience would like to give us some feedback, we would really appreciate it. We would like to know how useful the session has been for you, how relevant it is to your work, if the content was easy and clear to follow, whether the session was engaging, and last but not least, we'd like to know if you're likely to apply what you've learned today. And as the responses keep coming in, I'd just like to thank you everyone again for joining us today. And I wish you a great week and hope to see you again soon in the next session.